My name's Mark Sheehan. I'd like to welcome you on behalf of the Centre for Personalised Medicine, if I can do that, and the Ethox Centre. So it's just for me to sort of say a little bit about the start of the day. Just by way of, so my background is philosophy, and very strict, as it were, very theoretical philosophy. And one of the things that I've been interested to do, and indeed the connection to today, is to try to think about the ways in which the things that philosophers think about connect to actual contexts and problems that we face in the world. And that really is what we're trying to do today. So the two things that we're trying to bring together, if you look at the history and the ways of thinking about markets and money and commercialisation, we think in terms historically in terms of things like mammon and usury and references to lying and deceit and sharp practices. This is historically the way in which we've thought about this. Whereas we think about health and medicine, we think about caring and we think about the welfare of the patients and treating the sick and compassion and all those sorts of things. So that dichotomy has been around for millennia. And the philosophers, the ethicists, have done some work on this and have actually noticed the complexity of the issues and the ways in which those issues actually need more subtle analysis. And so some of the conceptual work that's been done on the way in which we understand the interaction between medicine and markets has really become a lot more nuanced and a lot more fine-grained. The problem, however, with this is that it's really not always engaged with real-life issues. It is to some extent, but not in every case. And often the concentration of the philosopher is very much not on particular kinds of institutional arrangements, but more about the ways in which we're to understand the tension between markets and health. So on the one hand. On the other hand, Oxford and the UK are really fortunate to be really importantly developing and leading in constructing population-level research institutions. So these are institutions that operate on a large population-level scale that involve lots and lots of data, of genomics, other kinds of health data, and really are set up to bring patient benefit, to help the health of the population. Now, the reality of these institutions is increasingly that they need to deal with commercial interests. The public healthcare system just can't deliver the kinds of research and the amount of research that we've come to expect and the developments that we've come to expect from medical research. So that's the tension. The tension is between the sort of long-standing concerns about involving markets in health with the increasing reality of having to do it. So the aim of today is really to start to bring some of the philosophical work and some of the analytic work in thinking about the complexities to bear on a number of particular problems, particular kinds of institutional and organisational problems about interaction. So in that respect, we've just constructed the day to make it actually require you to do some work. I'm sure you've all been to conferences that look really interesting, really good lineup of speakers on some hot topics, and then at the end of the day, nothing sort of come of it. I've done that once or twice too many times. So the idea here is that we're all thinking together about how to join up some of these dots. So the product here is some sort of way of thinking about the way of managing some of the ethical problems that we see about involving commercial interests in a health industry and trying to think about the ways in which population-level research institutions in particular, as we can characterise them, as we go on to characterise them, can manage that relationship in a constructive way. So the kinds of underlying questions here for the day, which we'll return to at the end of the day, are how are we to understand these institutions in such a way in terms of their values, what they're trying to instantiate, how we should understand the importance of the things that they do. And then how should we understand the threat, if it is a threat and where it is a threat, of involving markets in particular levels in particular ways. And then, of course, the problem is how do we negotiate and how do we manage those two interactions? So that's what we'll come back to later on this afternoon. But to start with, and to sort of lay the ground, we have a session that will look at the history and public attitudes and the ethics, just to sort of give us a sense of where we are in those sorts of contexts. And then this afternoon we'll think about the institutions that we're interested in.